Hello everyone. You'll all be aware that the number of positives is rising quite sharply now, and not only in Grand Cayman but in the sister islands as well. It's a concern for all of us, and my thoughts are with everyone who is positive or who may have loved ones that are positive and are naturally worried about the outcome. I think the good news is the large majority of us will sail through this. We may have some minor symptoms, some nasal stuffiness, some sore throat, some cough and a fever, but taking some paracetamol and simple measures such as this should see us through the event, especially if we're vaccinated. That's because most people will suffer with minor symptoms from COVID-19 disease. And that is also the benefit of having high vaccination numbers, because those people who are vaccinated are really protected against serious illness and any other poor outcomes. However, at the moment, because a lot of us are having to go into isolation, I think it's a good time to remember being well prepared, Cayman being prepared, and to think about stocking up of food, items, essential medicines and water, should you need that, in case you're asked to isolate or in case you have to look after somebody that's asked to isolate in your household. Largely as you would prepare for any disaster that's approaching, such as a hurricane. I know that some people are somewhat disgruntled that they have not received tests as quickly as they would like. Public Health did aim to phone everybody that's positive within 24 hours. However, with the growing number of cases, it's becoming increasingly difficult. As a result, a new process is going to be instituted whereby people who are positive will be sent an email, just like those who are negative. And along with that email will be instructions that anybody who is a new positive needs to isolate and continue to isolate. Those who are vaccinated for 10 days and those who are unvaccinated for 14 days. Many of you know that the HSA is undergoing some remodeling, particularly around the Accident and Emergency Department. This doesn't make the hospital look at its best, but hopefully it'll look a lot better once the work is done and will give everybody a better patient experience. So please provide the HSA understanding in that regard as they go through this essential remodeling process. Please also remember to respect all of the healthcare providers, whether they're first responders, people coming to your house, or whether they're people you're meeting in the clinics or in the casualty department or anywhere else in the public or the private sector. All of these workers are under a good deal of strain with the number of people feeling unwell at the moment. And they themselves obviously may have people at home who they're concerned about with their own problems.